Hello and welcome to Feedstuffs 365 and National Hog Farmer. I'm Ann Hess. Last month, the House of Delegates of the American Veterinary Medical Association voted unanimously to approve a resolution authored by Dr. Scott D. and sponsored by the Minnesota Veterinary Medical Association. Delegates adopted the policy on biosecurity, declaring the AVMA's support for science based programs and best practices to protect animals from threats of disease. Joining us to discuss this topic and more is Dr. Scott D. Welcome, Dr. D, and thank you for joining us today.
Hi, Ann. It's so great to be with you again. I'm looking forward to our discussion. Thank you for asking.
Well, before we dive in our discussion, I'd like to remind the audience to post your questions there in the chat or in the comments if you're tuning in via social media, and we'll get those over to Scott. So, Dr. D, we caught up with you at the PERS Symposium in Chicago in
Mhm.
December, and we discussed how science-based biosecurity plays a role in PERS prevention and control. But maybe for those in the audience who may not be familiar with your research in those areas, give us a refresher on the work you and Pipestone have done in this area.
Yes. So it goes back way to Y2K. Believe it or not, 25 years I've been working on how PERS virus and other viruses move around between farms and between countries. And it was kind of already known before that pigs and semen could infect a farm, but nobody really had any idea how else the virus could enter a farm. And so, with some great grad students like Satoshi Otaki and Johnny Cho and all these wonderful people I've worked with over the years, we kind of figured out that there are several indirect routes that we call, not from pigs and semen, but from other ways, such as fomites, so contaminated transport, boots and coveralls, supplies, aerosols, feed. And so we've taken this whole approach and put it together in what we call next generation biosecurity, which we think is a very good comprehensive way to think about all the science-based routes and all the science-based interventions against those routes. So producers, if they're going to do this, it's not a swag anymore. It's this is really science-based stuff. And if they do this and if they follow the rules, it's going to work. So it's kind of exciting to me. It's a new era in regards to disease prevention.
Yeah, I was going to say, you introduced this policy, I think a policy that wasn't on the books before for
Mm-hmm.
AVMA. What does the policy set out to do?
Well, after we published a couple of papers in 2024 that showed across 3 years in the Pipestone system, if we used these evidence-based protocols, we could take PERS infection down, but even below 10% for 3 years. And so that's never been done before. And so I was sitting there looking at these papers and I'm going, what else can we learn from this? And how can these papers benefit maybe not just pigs, but also other species? And I was thinking, well, my gosh, being with, I'm spending time in the AVMA right now, and I'm kind of wondering, maybe I should write a resolution that could be developed into a policy to show the importance of science-based biosecurity. So it's like, what else can we do with this science to take it beyond just a published paper or a dusty old bookshelf? How can we make it live on and everybody benefit, not just pigs, not just PERS, but beyond that? So that's kind of where it came from.
So, will this be a list of recommendations or guidelines for veterinarians for any species to put a biosecurity program in place?
Yeah, there's different levels of biosecurity across species. I think the swine industry and the poultry industry are a little advanced, but some of the other species groups don't have the same level of biosecurity. So this is kind of like a welcome to all, is to bring everybody in. Let's learn about how to prevent disease introduction, be it from the swine industry, the poultry industry. How else can we do this? So it's like an educational and a guidance document. It's not a regulation or anything. It's more of just good principles to follow. And again, we're going to try to write it across all species.
Yeah, I believe there's a quote following the meeting from a delegate there that said, with the H5N1 pandemic looming, we don't have time to postpone this, and
Hmm.
we need to start working on best practices now. What's next for this policy? I think they mentioned maybe a resource page going up as well.
Yeah, I think now that it's an AVMA approved policy, and I really appreciate the AVMA for adapting this. So they operate on policy, not regulation. So these are guidance, educational documents. The next plan is to develop a resource page, like you said, Ann, where AVMA members could go to this site and learn about biosecurity, learn about transmission of disease, if they're not already familiar with it, learn about the need to take this not just from pigs, but also into One Health, because this is spilling over into people now. So this is our true One Health crisis, and that was the focus, the comment you mentioned at the vote on this thing was like, we don't have time to screw around. We have to get this done, and so people are really involved, and it's exciting to see the AVMA House of Delegates, which is again 50 states, Puerto Rico, and 18 allied industry groups, all on the same page, saying that this is really important. So it's kind of fun to see a pig project lead to this next bigger project, and I'm excited to see what happens next.
Yeah, I mean, when we talk about One Health crisis, how does this policy fit in there with people, with planet, with
Mm-hmm.
production? How does that mold together within the One Health um, initiatives that are already in place?
Yeah, well, it started out with PRRS, but as we know, PRRS doesn't infect people; it only infects pigs. But along the way, this high path avian influenza, H5N1, which is a similar virus to PRRS, it's built the same way. And I was thinking maybe this could have the same approach because high path is getting into obviously poultry, it's getting into dairy cattle, it's spilling over into people, and it's getting into cats, both domestic and exotic feline species. So this is a true One Health crisis. This is not just pigs and PRRS anymore. This is a, several viruses. You could even put ASF in the same category, although that doesn't infect people. But these certain viruses are really detrimental to animals, animal welfare, economics for the farmers, and so it's like a total One Health situation where the people are involved as closely as the animals are. So such a unique time to have this move forward and develop a policy on what to do about it.
Yeah, absolutely. What's been the feedback thus far of this initiative from the veterinary community, but also, producers and industry members?
Well, it's very new. It just got voted on. I think it was on January 9th or so at the delegates meeting. It's like the Congress of the AVMA. And it was a unanimous decision to approve it. So that was really a big stamp of approval across all species, all veterinarians. And now we're going to develop this educational page. And so, but now we have to kind of spread the word. Like, I really appreciate our time together today that we're doing this because the more people that know about what has happened, because it literally just happened, barely a month ago. So it's very new, cutting edge news. And I think it's a marvelous way to see how science, good science can help write policy to help benefit the profession and the industries. To me, it makes a lot of sense. So I'm excited about doing this and getting involved further. So I'm all for it.
Yeah, we always visit with you at these conferences and things, and you're supposed to be retired, but what's what's on the horizon next? Are you going to be doing some more of that next gen biosecurity research? Are you taking this policy on the road and letting people know more about it for every species that will be
Mm-hmm.
included?
Yeah. So it's clearly right now it's in the camp of the AVMA. And I really appreciate the AVMA. There's over 108,000 veterinary members of the AVMA representing all species. And so the goal of the AVMA is to take this policy and develop an internal group and an external group of experts to how to devise the biosecurity page, so to speak. The where members can go online and they can click on links and they can learn about what's happening in biosecurity. They get educated, get up to speed, because the pork industry knows a certain level of biosecurity, which is higher than most, but that's not the norm across all animal species. There's a big difference between what happens across pigs, poultry, cattle, dogs and cats. We got to get everybody on the same page. And the AVMA didn't have a policy like this at the time. So this is like the foundational piece that says, okay, biosecurity is important and all AVMA members should be educated on the topic. And now we start developing the next step, which is further education, like we've talked about on a web page with links and things, experts here and there to help out. So it's really exciting. That's what I hope to be involved with more in the next, I don't know how many months, or we got to get this baby going. We can't let it sit too long. We got to get moving. So I'm excited to be involved with it on the onset.
Well, we're excited to, see this policy take shape and form and across all species, and look forward to hearing more about, your research in this area. So, Dr. Scott D., thank you so much for joining us today and sharing your insight.
My pleasure. It's never been done before, and I'm excited about being involved. And thank you for giving me a few minutes to share it with your audience. It means a lot.
Appreciate it. For you and our audience, for more coverage and conversations on swine industry related topics, be sure to check out the live and on demand section of Feedstuffs 365. For Feedstuffs and National Hog Farmer, I'm Ann Hess.